intervene early, do it fast, and do it well.
People become comfortable talking about mental health, the easier it will be for us to address the mental health issues in this country as a whole.
Hey there! Welcome back to the Mindcare podcast special 2-part episode. In case you missed the first one, Dr. Mark Platon talks about Mindcare services, the care team, and how Mindcare came about. Is that right, Janine?
Absolutely, JT. Episode 1 continues with our CMO, Dr. Querubin, as she talks about the barriers to access for mental health care and Mindcare's first step.
So, how does Mindcare Club do it nga ba? Let's get started.
So I think, JT, to address the question, we're really moving towards widening the services, not just targeting mental disorders or mental illness, which is a very traditional understanding of mental health, but actually opening it to mental wellness. So helping individuals in their normal day-to-day situation, the workplace, the school, the family, the community, and helping them manage their own stresses within that context. Mindcare Club is special in many ways, I think, because of its overarching vision of addressing how do we talaga ba lessen sadness in the world, diba? How do we do that? I mean, especially at this time where there is so much physical distancing, people get very isolated and lonely, and relationships that are supposed to prop us up when we are stressed are somehow challenged by the situation. So when we started the Mindcare Club, there were 3 main barriers to access to any mental health professional. So initially we were talking about the difficulties of young people, but what we're finding out is the difficulties with mental wellness is actually global. It cuts across socioeconomic status, education, gender, and age. Walang pinipili, no? Walang pinipili. Unfortunately, there are so many barriers for people to access care. Like, I think there are 3 main barriers. The first one is that there is a mismatch between supply and demand. There are too few health professionals who will actually take care of your mental health, and there is a huge demand. Now, based on WHO data, for example, in 2020, for every 100,000 Filipinos, there will only be 0.5 psychiatrists, 0.1 psychologist, 0.5 mental health nurses. It's mind-boggling. And that was an issue that I think Mindcare Club needs to address if we are serious about improving access to healthcare. So that's one, the mismatch between supply and demand. The second is the maldistribution. Konti na nga, and then these health professionals are all concentrated in the urban areas or hold clinics in hospitals. And so the idea is to get the mental health professional out of that and bring them closer to the people who need them. So that was why there was this whole idea of why don't we put them in the malls or nearer the schools so that the students can actually just, because we were watching when Brian and I were having coffee, we were just watching the kids walking around the mall were still wearing their uniforms from school. It was 4 in the afternoon. So if they hang out and they have coffee or ice cream or fries in that area, then perhaps if we made ourselves available there, we will be more accessible. So mismatch, supply and demand, the maldistribution, concentration in urban areas. So that also cuts off a lot of people who don't live in cities and near hospitals. And then I think the third, which is also key, is the cost. There is a misconception that if you have a mental health problem or you're distressed or you're sad, that you automatically have to see a psychiatrist. I am a psychiatrist, but what I'm saying is, as a specialist, psychiatrists should only be taking care of the complicated and severe or moderate mental disorders. The rest of the population, which would be the majority, can be handled or should be handled by psychologists, mental health nurses, counselors, and in that way, their needs don't need to escalate to the level of a specialist. So the key here is to intervene early, do it fast, and do it well. So I think what we're doing in Mindcare Club when we're talking about this first step program is actually addressing these needs. We want the patients or the clients who call us to actually be attended and assessed immediately without paying much more than they should for the service that they deserve. So we want to improve that access aspect of the mental health system. And I think in a very concrete way, that's how Mindcare Club does lessen sadness in the world. I think that's the thing that differentiates us. It's really a team of health professionals, multidisciplinary, and then offering people the first step. And I think that is something that will be very interesting to those who are listening or watching this podcast. Because what is this first step all about? And I think to me as a mental health professional, having worked in this field for several decades now, its time has come. Its time has really come. And so we invite everyone to give it a try. If you're not feeling all right, do not hesitate. Go to your computer, go to your phone, access the Mindcare Club website, and then give yourself a chance and take that first step. Because sometimes, I think most of the time, in fact, that's all you really need. Just take the first step.
Beautifully said, Dr. Lu. Thank you so much for all of your inputs. Do you have anything else to say, JT, or anything to ask?
I'm just awestruck with the mission and vision of Mindcare Club. It really democratizes mental health for everyone, everywhere actually, for all Filipinos. Imagine there's less than one mental health professional or a psychiatrist for a population of 100,000. That's a very daunting task, but we don't see the cases lessening soon, diba? Which is sad. But then with channels and outlets like Mindcare Club, I really believe that we really have a fighting chance of lessening sadness in the world. Maybe one person at a time or one organization at a time.
Yeah. So I'm really pushing for us to intervene sooner. We have to catch it early. We have to see them before they're actually diagnosable with any illness.
Right.
And help people understand the discomfort of that distress. And that begins with conversation. That begins with a first step. I feel so passionate about it because I've seen how that kind of early intervention can actually help people live better lives, and if that is the mission that we have in life, then let's go for it. Let's do it big time and let's achieve what we need to achieve. Life is too short. We cannot wait.
I agree, Dr. Lu. And, that's exactly what this podcast is for also. It's to extend that conversation beyond the clinics, whether it's physical or virtual, and put it out there because I think the more that people become comfortable talking about mental health, the easier it will be for us to address the mental health issues in this country as a whole. And maybe even encourage others to, explore this profession and be inspired to pursue a career in mental health. There's a lot of room for everyone. And I think it will be such a great service for Filipinos if we had more people wanting to serve in the mental health sector. Great job, you guys, for hosting this podcast. And we look forward to seeing more episodes. And we're curious about what topics you're going to be talking about and sharing with your viewers. And we wish you the best.
Thank you very much,
Very much.
JT and Janine. It's really wonderful to spend this time with you guys. So I'm really hoping that the people who view or listen to this podcast will actually raise their questions, and maybe chat with us as we go, because we want to be able to provide evidence-based information for everyone. There's so much fake news out there. I hope this podcast will provide facts and information that will help people.
Right.
So thank you very much for having us. It was really a pleasure.
Thank you.
The pleasure is ours. Thank you so much po.
Thank you very much for what you do. It's something that we look up to.
Yeah.
Thank you. It's a privilege.
Thank you, everyone.
Thank
you,
you.
everyone.
Bye.
So there you have it, everyone. That was our CEO, Dr. Mark Platon, and our CMO, Dr. Querubin. What do you think, JT?
Well, I think that was a very great episode, and that we had the opportunity to hear from the people who are trying to change mental health care in the Philippines. It's a privilege to experience it firsthand.
I completely agree. So this wraps up our very first episode of the Mindcare podcast. Thank you, everyone, for joining us today. And if you're ready to take your very first step, you can visit us at our website, mindcareclub.org, and sign up for an appointment. And sometimes the first step is all you need.
And don't forget to like and share this video and help us lessen sadness in the world. We'll catch you on Wednesday, September 8th for the Mindcare podcast second episode.
Bye.
Bye.